Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Volodi, and today we are joined by Dr. Kristie Marble, who very similarly does things that I do here
Mhm.
as well in terms of working with hospitalized patients in the hospital, but also working in a Down syndrome clinic. And one thing that I've learned over the years is there's a lot of overlap, particularly in the fall and winter when all the viruses are going, and where my two
Mhm.
worlds will collide, where kids I see in clinic are in the hospital, and I'm seeing them in the hospital too. And I'm sure Dr. Marble may have some similar findings herself. But before we
Mhm.
get too far, Kristie, I hope it's okay I call you Kristie during the podcast.
Yes, that's fine.
Perfect. Tell me who you are and tell our audience what you do and what it is that makes you love working with this population.
Yeah, absolutely. Well, hi, I'm Kristie Marble. I'm a DO. I am a board certified pediatric hospitalist. I work at Children's Mercy in Kansas City, Missouri. And like you said, I'm one of the pediatricians for our multidisciplinary Down syndrome clinic. I absolutely love both my jobs. As a hospitalist, I get to see a lot of kids come in that are really, really sick, and then they end up leaving looking like they were never sick to begin with
Uh-huh.
sometimes. And I just love that resilience that children seem to have. And then with my other job, with my other hat in the Down syndrome clinic, I particularly love working with the Down syndrome population as a whole. I myself have a daughter that's 16 years old now who has Down syndrome, and she has taught me so much, not only as a mom, but also as a physician, that can help provide families with a more personalized touch at their appointments. Um, and so I have found that working in this clinic has just provided me some of the purest joy I've
Yeah.
experienced in my job. So that was just one of my favorite things to do. And I'm so glad they allow me to do these two different jobs.
Yeah, that's amazing. Yeah, I love that overlap, and I also love how it overlaps even into your personal life as well.
Yeah.
Very similar kind of feel that I have as well. So always great to have a club member on the podcast.
Mhm.
The club membership is just that you have a family member with
Yeah.
Down syndrome, and so that's really
Mhm.
cool how she's impacted you. So a
Yeah.
lot of people listening to the podcast may never have heard or at least not understand what is this word hospitalist? Is this
Yep.
someone who takes care of a hospital? Like, what is a hospitalist? What is it that we do?
Yeah, trust me, I get that all the time. So basically, a hospitalist is a doctor that works only in the hospital. They only take care of people who cannot leave the hospital for various reasons. If people are, people, adults, children, they're staying in the night in the hospital because they can't, because they're too sick to go home for whatever it is. A lot of times they are being admitted from the ER or an outpatient office. And that's all we really do. We get them better so they can go home.
So why would it be you or I seeing them as a hospitalist and not just their doctor who they see in the clinic all the time?
Well, that's actually a great question. Over the years, the medicine has evolved to where doctors who see kids only in the hospital, there are very certain types of diseases and disease processes that are treated in the hospital that aren't treated outpatient. And so those outpatient doctors and inpatient doctors have kind of evolved and come into these different niches
Hmm.
that uh, basically makes it difficult for them to cross back over.
Yeah.
The learning curve ends up, you use it, you lose it. Sort of like learning a second language. You don't use it,
Yeah.
you lose it. Same with not working in an outpatient clinic. If I were to try to jump back into an outpatient clinic right now, I would feel lost.
Yes.
I'm not up to date with all uh, the different nuances, the guidelines, well child visits, and things like that, and kind of vice versa with the outpatient clinic. There's a lot of evidence based medicine that is evolving all the time with all the research that comes out, and those doctors can't keep up on that as on top of all the other things they're doing to be able to cross back over to the inpatient population.
Yeah, that's perfect. I think that, and that's just been kind of the trend in pediatrics and medicine in general. There was a time where the outpatient doctors were doing ICU and ER care. And of course, we have specialists in those areas. And then here within
Hmm.
the last, I don't know, 4 or 5 years, hospitalists, especially in pediatrics, have been recognized as its own specialist as well.
Hmm.
So that's
Yeah.
great. What are some of the diagnoses that you see when somebody with Down syndrome is admitted to the hospital? Are there some pretty common things that you might see?
Yeah, there actually are. Probably the very most common thing that we see admitted is um, are kids who have respiratory illnesses, bronchiolitis, pneumonia, things like that. Now, bronchiolitis is not necessarily a common term that parents know either. So, just briefly, bronchiolitis is where a virus comes and invades the lower parts of the lungs, and it causes the lungs to become swollen and filled with mucus, and it doesn't allow the baby or toddler to be able to breathe very well. And then a lot of times when they're admitted, they're needing oxygen. Um, so with our Down syndrome population, we really see that a lot more, and it's one of the more common things that we see, especially when they need oxygen.
Hmm.
Some of the other things that we do see outside of that are things like not growing well. They are not, growing or gaining weight appropriately like they should, and there's various reasons for that. Sometimes it's because they're not swallowing appropriately. A lot of it can be related to their low tone, and sometimes it's related to like a congenital heart anomaly. Where their body is needing more calories and to make their heart pump and provide their body the nutrition they need. So those are some other kind of common things that we see.
And what is it? What's the reason why we think that maybe respiratory issues are just so common in people with Down syndrome? What is it that makes them more likely to get these kinds of infections?
Yeah, so there's actually been some good studies that have shown that unfortunately our wonderful children with Down syndrome, when they're born, their thymus didn't develop appropriately. And when that happens, they lose lymphocytes. Their lymphocytes aren't as abundant as someone with a normal thymus, and as well as their T cells. Both
Hmm.
those things are needed to help protect us from contracting viruses. And so when you have low lymphocytes and low T cells, your body just it can be exposed in the same way as somebody with a normal thymus, and you get the virus. The but the person with the normal thymus does not
Yeah.
get the virus. So unfortunately, it does make it just that much more easier for them to get viruses, um, which then can lead to the other complications that we end up seeing.
Yeah, the immune system is just so complex and complicated for all of us, but why when it doesn't work the way we want, certainly that's something that we're seeing more often in somebody with Down syndrome, for sure. And our listeners can listen to the prior podcasts that we've done with immunology experts if you want to get even
Mm,
more detail. But that's exactly it. It's just we just see way more respiratory infections in people with Down syndrome. And I
yep.
guess, one of the aspects that you can bring that perhaps other doctors may not be able to bring is that you've been on both sides of the door, as they say, both as
Yep.
the doctor and also as a parent. And I guess my
Hmm.
question would be, what would be some advice that you might give a parent about when their child is admitted, ways that they can advocate for their child while they're there?
Yeah, absolutely. Not and just to add to what you said, being
Yeah.
on both sides of the fence, my daughter, when she was 2, she was actually admitted to the hospital requiring oxygen for a couple days. So I really seen both sides of this question.
Yeah.
So some of the things that I thought about as a parent and ways to advocate when you're admitted to the hospital, which I hope no, if all the listeners do not have to experience this, but
Yeah.
in the event that you do, um, one of the things is don't hesitate to let your nurse know that you think there's a problem.
Hmm.
If you're seeing your child worsening, looking like they're breathing harder, alert the nurse right away. The other things that I've noticed is, there's times where some nurses are less comfortable with like lower numbers of the oxygen saturation numbers. At our hospital, we don't put on oxygen until they're less than 90, usually around 88%. we will put someone on oxygen. I do believe there's been recent evidence that 89, 90 is safe for individuals. It may not be normal, but it's safe. And
Mm-hmm.
so if I'm finding that a nurse is a little bit on the nervous side, I kind of make a point of like, let's make sure that you're not increasing the oxygen when it's at the 90 level. Wait for it to go 88, or even the vice versa. If it's over 95 and nobody's weaning the oxygen, let say something to our nurse like, hey, he's been above 95 for an hour or so. Can we try to wean down the oxygen?
Mm-hmm.
And then the other thing, sticking with when you're admitted because you're needing oxygen, there's also kind of the opposite to that, where you've gone a few days and your oxygen levels are stable. You're not able to come off the oxygen, but you're stable. You're not, your numbers aren't going up or down, and you aren't, or not you, but the child isn't breathing fast and they're drinking well, and they otherwise appear to be somewhat back to their normal activity. It's not unreasonable to ask to go home with oxygen.
Mm-hmm.
We have done that several times at our hospital. It's something that we think about as hospitalists when we have a patient who has Down syndrome or have lower muscle tone for other reasons, as something that we can do for the family to get them home sooner.
Yeah. Yeah, and I know that we also will see many times when the children will be admitted for a respiratory issue, that often the sleep apnea that maybe they've had but it hasn't really been fully evaluated yet may start to show itself because they'll start to have
Yes,
lower oxygen levels in the nighttime. It sounds like you see that too. Yeah.
absolutely. We absolutely do.
Yeah.
And that's also something, for parents to be aware of. For one, you know, kids with Down syndrome have a higher likelihood of having obstructive sleep apnea compared to the
Hmm.
general population. And to have that awareness, so when they're inpatient and you're seeing that their oxygen levels are dropping, particularly at night,
Hmm.
that may be something to be evaluated. They can ask, in our hospital, we can ask the pulmonologist to stop by and see what they think about possible, obstructive sleep apnea. And we have a pulse oximetry test that we can do and do labs to look at their ability to breathe at night and see if that's been affected, type of stuff. So I would advocate for that too.
Yeah. And I couldn't agree more with what you said earlier about, for a family to make sure that they let the nurse know, or if the doctor's in the room, let the doctor know when they have a concern. Because I think that one thing I've seen so many times, especially in our patients, is that their respiratory status can change very quickly. And all of a sudden
Yes.
they're going from breathing comfortably and happy to, requiring an ICU setting kind of thing. And so really
Yeah.
important if a family notices those changes happening that they would bring that up. So I think that's so important.
Yeah.
Um, yeah.
Yeah.
Well,
I agree. I tell every parent that is admitted with a respiratory anything, asthma, pneumonia, whatever it is, that someone's going to be by every 4 hours. However, if something's happening within that 4 hours, please
yeah,
let someone know.
yeah, definitely. Well, I think this is really great. I love the fact that you're able to bring your personal family experience as well as, your job career excitement to what you do. Is there anything else that you wanted to make sure that we discuss, or any kind of final kind of summary thing that you would like to leave for our listeners on the podcast today?
Yeah, one of the things that we didn't touch too much
Yeah.
on is your child's admitted and they're admitted for maybe not respiratory illness, but maybe like, not gaining weight well
Hmm.
or things like that. And they're due for their yearly labs and
Mm.
someone wants to do labs for other reasons. I'd have the parent advocate to go ahead and grab their yearly labs during that one poke to save them a poke
Hmm.
from later.
Hmm. Yeah, that's a great idea. I mean, sometimes when they're really sick, it might make the thyroid a little bit off, but
Yes.
it might be normal too. And then you save yourself that later stick. If
Yeah.
yeah,
That's kind
yeah,
of the more important piece for families to be aware of, though. If they're really sick, those levels can look not normal, and they may
yeah,
still need that second
yeah,
that second poke. But if
yep,
they're like either like a lot better or they're there for
yep,
some other reason, they're getting it
yeah,
clean out for constipation, which is
sure,
another common hospitalization issue,
yeah,
or the weight gain issue. Those are times where they're not really really sick and
yeah,
shouldn't have too much variation in
yeah,
those numbers at that
yeah.
point.
I love it. That's great advice. Well, great. Well, thank you so much, Kristie. I really appreciate you coming on the podcast and sharing your experience with our families and being able to share your experience as a mom and being on the other side of the door, as I often say.
Yeah.
So thank you so much for joining us.
Yeah, thank you for having me.
Yeah, and for our listeners, I want to make sure you know, of course, if you have any questions or anything you want us to address on this podcast, please send me an email to downsyndromecenter@chp.edu. And if you would like to join us in the work that we do here at the center, including this podcast, please go to givetochildrens.org/Down Syndrome Center. But until next time, bye-bye.